Hi guys, Tracy again. Just wanted to talk to you guys a little bit about the nest rules of engagement. So I have kind of typed this up a little bit for your reading pleasure, but these are just a couple little bullet points for you guys to remember. So everyone has to perform hand hygiene before entering a baby's nest. If you come over and lift up the cover on the isolette, to silence the monitor, reset an IV pump, give an O2 breath on the ventilator, if you don't perform hand hygiene, it is cross-contamination. So by me just walking into the nest and doing this and looking at the baby, cross-contamination. Anything brought into the nest, transilluminator, feeding pump, anything like that, iStat machines, glucometers, anything needs to be disinfected before you bring it into your nest. You should have a good stock of chucks as well. So anytime I still disinfect it and I put anything that I need on a chucks, okay, I put it either on top of the bed, disinfect my iStat, and I put it up here. So I just make it a habit. I feel like I use lots of chucks. No sleeves when doing patient care. This is something that we've kind of gotten away from. So just to show you, when you go in to an isolette, this is what's happening. A lot of times, people are even saying, well, I'm rolling my sleeves up. But you can still end up doing this. You can still end up having some contact with the sleeves on your jacket to the portholes. So it's really important to remember no sleeves. And a lot of times it's 80 degrees in the NICU anyway, so don't have to worry about it. Milk syringes, I said this before, make sure that you put them in a glove and put them, before you put them in the bottom of your bed to warm, if that's the method that you use to warm your milk. One of the things that we're going to put in effect is something called Stethoscope Sunday, and that is actually the responsibility of the bedside nurse, and it is taking apart your stethoscopes and cleaning it and getting all the funk out of it because they are nasty. But it is the responsibility of the day shift bedside nurse every Sunday at any point during the day when you have a few minutes. We don't use personal stethoscopes in here, but I don't think we have any issues with that. Again, use the chucks as your landing pad for everything, IV starts, OG, NG placement, heel sticks when you get your labs, your heel sticker, your ChloraScrub pad, any lab bullet that you might need, your boo-boo Band-Aid, your little 2x2, whatnot. Everything goes on here. You fold this up. It goes in the bed. You're ready to go. Gel your hands, put your gloves on, ready to go. Use the chucks for all diaper changes. Again, the chucks, your diaper, wipes, whatever, put it at the base of the bed. When I'm done changing a diaper, I will, so if this is, and I have gloves on, y'all just pretend. What I do with the dirty diaper is I fold the chucks over and I kind of move it more towards the foot of the bed. And then with my dirty gloves, take it out, weigh the diaper, perform hand hygiene, put gloves back on, and then get back in, position your patient, give them a pacifier, that sort of thing. Use friction when disinfecting your nest. I talked about that a few minutes ago as well. If you're just lightly rubbing it, it's not doing anything. Make sure that those Santa cloth wipes are really wet, and make sure you're really putting some elbow grease in it. Respiratory therapy will disinfect any of their respiratory equipment. They have to use Cavicide wipes for their stuff, so that is their responsibility. Another thing that I've seen a lot lately is the paper tape measures. Those are single use only. That's why we have paper. Use them one time to get your girth, get your pick measurements, and then throw them away. So you should have like 5 in your bed at all times. Oral syringes are also single use. If you're pulling back to kind of check your residual, you know, sometimes I'll see them in the little hole at the foot of the bed because I guess people are using them every 3 hours to pull back. Don't. It's a warm environment. Stuff's going to grow probably pretty quickly. So those are also single use. Once you've used it, throw it away. And that's all I have. So you guys, again, my name is Tracy Drigas. Let me know if you have any questions.